Hey everyone, you know how sometimes you think, wouldn't it be amazing if, and then years later it's just normal?
Like self-driving cars or
Yeah, exactly.
yeah.
So what if your doctor had AI that could see diseases like way before you even felt sick?
That future might be closer than you think.
Right.
AI and data are already changing healthcare in some pretty incredible ways.
That's so cool. Well, to help us make sense of all this, we're taking a deep dive into this report called Healthcare AI Data and Ethics, the 2030 Vision.
Great report. It came out back in 2018 after like a whole year of discussions with European healthcare leaders, and they were already seeing these big changes on the horizon.
So are we like living in their future now?
Kind of, yeah. It's fascinating to see how many of their predictions are coming true. Like one thing they highlighted was how most patient data back then was like scattered everywhere.
Oh yeah, that makes sense.
Different hospitals, different labs, even on people's fitness trackers. It's all over the place.
So it's like trying to put together a puzzle, but you don't have all the pieces.
Exactly. It's a real challenge.
Right.
But before we get too deep into that, we want to give a huge shout out to London Heartbeat Z Academy for supporting this deep dive.
They're amazing.
They offer over 140 healthcare courses, which is incredible, and they've got tons of free resources on all their social media.
So definitely check them out on Facebook, Instagram, Spotify, and YouTube.
You won't want to miss their content. It's really good stuff.
Now back to this report and those missing puzzle pieces. It basically lays out three main challenges we need to tackle to reach what they call intelligent health.
Right. Intelligent health, meaning healthcare powered by AI and patient data.
So challenge number one is all about data silos and interoperability.
Two words that don't exactly roll off the tongue.
I know, right?
But basically, it means all that important health information is stuck in separate systems that can't talk to each other.
Like if your primary care doctor's office uses one system and then the specialist you see uses another, and the hospital you went to last year uses yet another.
And none of them can share information easily. It's a mess.
Okay, so how do we fix it? How do we get these systems to actually talk to each other?
Well, one solution is to use a common language, a standard way for all these systems to communicate.
Okay.
And that's where FHIR comes in.
FHIR.
Yeah, it stands for Fast Healthcare Interoperability Resources.
Catchy. But what does that actually look like in the real world?
So imagine you get sick while you're traveling. With FHIR, the doctor you see could securely access your medical records from back home.
Even if they use a totally different system.
Yeah, exactly. They'd have all your allergies, medications, everything.
That would be so much better than trying to remember everything off the top of your head.
Right. It would make things so much smoother and safer. But it's not just data from hospitals and doctors.
Oh, yeah.
There's a ton of health data that we're all collecting ourselves these days.
With our Fitbits and smartwatches and all those health apps.
Exactly.
Yeah.
And that's what they call patient-generated data, or sometimes PROMs, patient-reported outcome measures. So like how well you're sleeping or how much you're exercising or even just how you're feeling day to day.
All of that.
That's actually really valuable information.
It is. It gives doctors a much more complete picture of your health than they could get from a few checkups a year. But the challenge is figuring out how to integrate that data with traditional healthcare data.
Yeah, because your smartwatch doesn't exactly speak the same language as your doctor's electronic medical record system, right?
Right. So we need to develop tools and frameworks that can bridge that gap and ensure the data is accurate and reliable.
So we're not just adding more noise to the system.
Exactly. And there's some really cool technologies that can help with this. One that holds a lot of promise is blockchain.
Blockchain, like cryptocurrency.
Yeah, it's the same technology, but it has applications far beyond that. In healthcare, blockchain can help ensure data security and what's called provenance.
Provenance, what's that?
It basically means knowing where the data came from and being able to verify that it hasn't been tampered with. So kind of like a digital trail of breadcrumbs for your data.
That's a great way to put it. And this is important because it builds trust.
Trust in the data itself.
Exactly. You know you're getting the real deal, the original information. And there are already some real-world examples of this in action.
Oh yeah, like what?
Well, one example is Patient Voice. It's a platform developed by Microsoft and EFCCA. It stands for the European Federation of Crohn's and Ulcerative Colitis Associations.
Okay.
And this platform uses blockchain to give patients more control over their health data.
So they can choose to share their data with researchers or doctors.
Exactly. And it's all done securely and transparently. They even use standards developed by ICHOM, the International Consortium for Health Outcomes Measurement, to ensure that everyone's on the same page when it comes to measuring treatment effectiveness.
So it's like patients are actually participating in research and helping to shape the future of healthcare.
Exactly. They're not just passive recipients of care anymore, they're active partners.
That's so cool. But even with all this amazing technology, it feels like there's still this big question of trust looming over everything.
You're right.
I mean, we're talking about something as personal and sensitive as our health data.
Absolutely. Trust is paramount.
And that brings us to the second challenge outlined in this report: building public trust.
This is huge.
Like, how do we make sure that people feel comfortable and confident sharing their health data in this new world?
Well, the report acknowledges that there's a lot of work to be done in this area, but thankfully, Europe has already taken a big step forward with something called the General Data Protection Regulation, or GDPR.
GDPR.
It sets high standards for protecting personal data, including health data, and gives individuals more control over how their information is used.
So it's kind of like a safety net for our data.
You could say that, yeah, it helps to create a more ethical and trustworthy environment for data sharing.
Okay, that makes me feel a little better.
But even with GDPR in place, there are still some tricky areas to navigate.
Like what?
Well, one of the big ones is the secondary use of data.
Secondary use.
It means using data for purposes beyond your direct care, like medical research, for example.
Oh, right. So my data could be used to help develop new treatments or cures.
Exactly. And while that's incredibly important, we need to make sure it's done ethically and with patients' full consent.
Right, because on the one hand, we want to encourage research and innovation,
Of course.
but we also need to respect people's privacy and autonomy.
Absolutely. It's about finding the right balance.
So how do we do that?
Well, the report explores some interesting ideas like data donation and data commons.
Data donation. Is that like donating blood, but for data?
It's a good analogy. It means you're choosing to contribute your anonymized health data to research projects that you believe in.
So it's not just about protecting data, it's about giving people agency.
Right, giving them a voice and a choice in how their data is used.
I like that. But how do we ensure that this data is actually used responsibly and ethically?
Transparency is key. Healthcare providers, researchers, technology companies, everyone needs to be upfront about how they're using data and what measures are in place to protect privacy.
No more hiding behind complicated terms and conditions that no one reads.
Right, it needs to be clear and understandable. And it's not just about informing people, it's about engaging them.
Like making them active participants in this whole process.
Exactly, because ultimately, trust is built on a foundation of transparency and respect.
Okay, so we talked about data silos and public trust. But there's this whole other layer to this that feels even bigger.
You mean the ethical considerations of AI?
Yeah.
That's where things get really interesting.
It's not just about the technology itself, it's about how we use it
Right.
and what it means for us as individuals and as a society.
Absolutely. And this is where the report's third challenge comes in.
Okay, so what are the ethical dilemmas we need to be thinking about when it comes to AI in healthcare?
Well, one of the big ones is bias.
Bias. Like AI algorithms discriminating against certain groups of people.
It's a real concern, and we've seen examples of this happening in other fields.
So how do we prevent that from happening in healthcare?
Well, the report suggests that we need to be very intentional about how we design and train AI systems. We need to make sure that the data we're using is diverse and representative, and that we're constantly monitoring these systems for any signs of bias.
Okay, so it's not just about building the technology, it's about building it responsibly.
Exactly. And that leads into another key ethical consideration: transparency.
Right.
People need to understand how AI systems are making decisions, especially when those decisions affect their health.
Because otherwise it just feels like magic or like we're giving up control over our own bodies
Right.
to these mysterious algorithms.
You need to be able to see the reasoning behind the recommendations.
So it's not just about AI being accurate, it's about it being explainable.
Exactly. And the report actually highlights 6 key principles for responsible AI development. These were put forward by Microsoft, and they really get to the heart of this ethical challenge.
Okay, what are they?
So the first one is fairness, which we've already talked about.
Making sure that AI systems treat everyone equally, regardless of their background.
Right.
Okay, what's next?
The second principle is reliability and safety.
Which means making sure that these systems actually work as intended and don't pose risks to patients.
Yeah, we can't have AI making life or death decisions if we're not confident that it's going to make the right ones.
Makes sense.
What else? The third principle is privacy and security, which we've also touched on.
Protecting people's sensitive health data.
Right, that's absolutely crucial.
What's number 4?
The fourth principle is inclusiveness,
Inclusiveness.
making sure that AI systems are designed to benefit everyone, not just a select few.
So not just people who can afford the latest technology or live in certain parts of the world.
Exactly. It's about making sure that everyone has access to the benefits of AI in healthcare.
I like that. What are the last 2?
The fifth principle is transparency, which we've talked about a lot already.
Being open about how AI systems work and how data is being used.
Right. And the sixth principle is accountability,
Accountability.
which means making sure that someone is responsible for the decisions made by AI systems.
So if something goes wrong, we know who to hold accountable.
Exactly. And these principles are really important because they provide a framework for ethical AI development. They help us to ensure that we're using this technology in a way that benefits humanity.
Okay, but this report came out in 2018. A lot has changed since then.
Oh, definitely.
Are these principles still relevant today?
Absolutely. If anything, they're even more important now than they were back then. The field of AI is moving so quickly, and we need to make sure that we're not sacrificing ethics for the sake of progress.
So we need to be having these conversations now more than ever.
Absolutely.
Okay, so let's talk about one specific ethical consideration that I find really fascinating.
Okay.
The idea that AI should augment human intelligence, not replace it.
Yes, the classic human versus machine debate.
Exactly. But it seems like the report is pretty clear on where it stands on this.
Oh, yeah. The report emphasizes that AI should be a tool to enhance human capabilities, not to replace human doctors.
So it's not about AI taking over. It's about AI empowering doctors to do their jobs even better.
Exactly. Because at the end of the day, healthcare is about human connection.
It's about empathy and compassion and understanding.
Things that AI just can't replicate.
So it's about finding the right balance between human expertise and AI insights.
Right, a collaboration where each brings their unique strengths to the table.
That's actually a really hopeful vision of the future.
It is.
One where AI helps us to create a more humane and compassionate healthcare system.
I think that's a future worth striving for.
Absolutely.
And it all starts with having these conversations, being aware of the challenges and opportunities, and making sure that we're putting ethics at the forefront of everything we do.
I agree. So much to think about. So we've talked about data silos and public trust, and we've just scratched the surface of the ethical considerations surrounding AI in healthcare. But this report doesn't just highlight the problems, it actually offers some solutions too,
Right. It's not all doom and gloom.
thankfully.
Yeah.
So what can we actually do to address these challenges and build a future where AI is used responsibly and ethically in healthcare?
Well, let's start with those data silos. The report really emphasizes the need to promote open standards like FHIR to make it easier for different systems to talk to each other.
Remember that universal translator for healthcare data we talked about?
Exactly. We need to create a system where information can flow freely and securely.
So no more data getting trapped in isolated systems.
Right. It's about breaking down those digital walls and creating a truly interconnected healthcare system.
Imagine a world where your doctor could instantly access all your relevant medical information, no matter where you've been treated.
No more repeating tests, no more gaps in your medical history. It would streamline care, reduce errors, and ultimately lead to better health outcomes.
That would be a game changer. But it's not just about the technology itself, is it?
No, it's also about fostering a culture of collaboration and data sharing within the healthcare ecosystem.
Right. It's about getting everyone on board with this vision of a more connected and data-driven healthcare system.
Exactly. We need to move away from this kind of siloed mentality and start working together towards a common goal.
And the report also suggests exploring new technologies like blockchain to enhance data provenance and security, right?
Yes, blockchain has the potential to revolutionize how we share health information.
Remind me how that works again.
Well, it's basically a digital ledger that keeps track of every transaction and every change made to a piece of data. And this ledger is distributed across a network of computers, so it's virtually impossible to tamper with.
So it's like a super secure way to track data and make sure that it hasn't been altered or corrupted.
Exactly. And this is really important for building trust.
Trust in the data itself.
Right. You know you're getting the real deal, the original information.
But how do we scale that up to a global level? Healthcare data doesn't stop at national borders.
You're absolutely right. We need international cooperation to create a global infrastructure for secure and interoperable health information exchange.
So that no matter where you are in the world, you can access your medical records and receive the best possible care.
Exactly. It's a big vision, but I think it's achievable if we work together. But of course, as we've already discussed, data sharing on this scale requires trust.
And that brings us back to the report's second set of recommendations focused on building public trust.
Right. Because even with all the technological safeguards in place, people need to feel confident that their data is being handled responsibly and ethically.
So how do we go about building that trust,
Yeah.
especially when people are understandably concerned about privacy and security?
Well, the report emphasizes the importance of clear communication, transparency, and demonstrating the value of data sharing for research.
We need to show people how their data can be used for good, not just for profit or surveillance.
Exactly. And that means telling those success stories.
Like how data sharing has led to breakthroughs in medical research or helped to develop life-saving treatments.
Right. Those stories can be really powerful in helping people to see the potential benefits of data sharing.
But we also need to be upfront about the risks and the challenges.
Of course. It's about being honest and transparent and empowering individuals to make informed decisions about how their data is used.
And the report also talks about data donation right, giving people the option to contribute their data to research they believe in.
Yes, data donation is a great way to engage people in the research process and give them a sense of ownership over their health information.
It's about moving away from this idea of data being taken and towards data being given with consent and a clear understanding of how it will be used.
Exactly. And that can go a long way in building trust. The report also delves into some more technical aspects of trust building, like investing in technologies that enable secure machine learning.
Like differential privacy and federated learning.
Yes, those are two really important concepts.
Okay, I'm gonna need a refresher on those.
Sure. So differential privacy is basically a way to extract insights from data without revealing any personal information about individuals.
It's like blurring out faces in a photo so you can still see the overall scene, but you can't identify anyone specific.
That's a great analogy. And federated learning is a way to train AI models on data that's distributed across multiple locations without ever centralizing it.
So you can train AI algorithms on sensitive health data without ever actually moving or exposing the data itself.
Exactly. It's a really clever way to protect privacy while still enabling research.
So it sounds like we're making some real progress towards a more secure and trustworthy data ecosystem. But what about the ethical considerations of AI? How do we make sure that these powerful technologies are used responsibly and that they don't perpetuate existing biases or create new ones?
That's a crucial question, and it brings us to the report's final set of recommendations. The report calls for the development and adoption of ethical frameworks to guide the development and deployment of AI systems in healthcare.
So it's about embedding ethical considerations into the very DNA of AI development.
Exactly. We need to move beyond just talking about ethics and start putting those principles into practice.
And the report also highlights the importance of explainability and intelligibility, right? Making sure that we understand how AI systems arrive at their decisions, especially when those decisions have life-altering implications.
Yes, black box AI has no place in healthcare.
We need to be able to understand the reasoning behind an AI's recommendations.
To identify potential biases or errors.
And to ensure that human clinicians are ultimately responsible for making treatment decisions.
Right. It's about finding that balance between human expertise and AI insight.
A collaboration where each brings their unique strengths to the table. This has been a really encouraging conversation. Seems like there's a lot of work being done to address the challenges and opportunities of AI in healthcare.
There is. It's a rapidly evolving field, but I'm optimistic about the future.
Me too. Especially when we see so many people committed to using this technology responsibly and ethically.
Absolutely. It's about putting people first.
It really does feel like we're at a turning point in healthcare.
We are. AI has the potential to transform healthcare in ways we can barely imagine, but we need to be careful.
Yeah, careful and thoughtful about how we develop and use this technology. So out of everything we've discussed, what from this report really stood out to you?
Honestly, what struck me most was how much the report emphasizes the human element. You know, with all this talk about data and algorithms, it's easy to forget that healthcare is ultimately about people.
Right. It's about human connection and empathy and caring.
Exactly. And I think that's something we need to keep in mind as we move forward with AI in healthcare.
The report definitely makes it clear that technology should serve humanity, not the other way around. It's about AI empowering healthcare professionals, not replacing them.
Right. It's about collaboration, not competition.
Yeah.
And that's why building trust is so essential. We need to trust not only the technology itself, but also the people and institutions using it.
Trust, transparency, and accountability. Those are the key ingredients for a responsible and ethical AI-powered healthcare system.
Couldn't have said it better myself. This report lays out a solid foundation, but it's just the beginning.
Because the landscape of AI in healthcare is constantly changing, right? New challenges and ethical dilemmas are going to pop up all the time.
Exactly. We need to be prepared to adapt and refine our approach as we go. And that means having these conversations.
Open and honest conversations about the potential benefits and risks of AI in healthcare.
Yes. And those conversations need to involve everyone: patients, healthcare providers, researchers, policymakers, and technology developers. We all have a role to play in shaping the future of healthcare.
Well said. This deep dive has been incredibly insightful, and I hope our listeners feel inspired to participate in this crucial conversation.
Me too. We've only just begun to explore this complex and rapidly evolving field, and there's so much more to learn and discuss. But I'm confident that if we work together and keep human values at the forefront, we can create a future where AI makes healthcare more humane and compassionate for everyone.
And a huge thank you to London Heartbeat's Z Academy for their support in making this deep dive possible.
Be sure to check out their website and social media channels for a ton of great healthcare resources.
They offer over 140 courses and tons of valuable information. You can find them on Facebook, Instagram, Spotify, and YouTube. Thanks for joining us on this journey into the world of healthcare AI, data, and ethics. We hope you learned something new and feel inspired to stay curious, stay informed, and stay engaged in this crucial conversation.